Hello all, my name is Elizabeth Torres and I'm a graduate student here at UNLV in the Nutrition Sciences program. Today I will be going over my topic of interest, which is food insecurity and type 2 diabetes. I will be going over what food insecurity is and what type 2 diabetes is and how they affect each other. So what is food insecurity? It is when households were unable to acquire adequate food for one or more household members because they had insufficient money or insufficient funds and other resources for foods. And just in 2020, about 10.5% or 13.8 million of US households were food insecure, and that equates about 38.3 million people were living in food insecure households, which is a considerable high number. So this chart is showing the households that were more prevalent to experience food insecurity, and the highest one that I would like to point out here is single women-led households with children. They were more likely to experience food insecurity at about 27.7%. And then in race and ethnicity, Black non-Hispanic households were also more likely to experience food insecurity at 21.7%. So I think this chart just gives us a good overall of those who are more likely to experience food insecurity here in the US. So what causes food insecurity? So as we've learned this semester, there are multiple factors that contribute to it, and I've listed a few here, such as the lack of income. Generally, that's due to unemployment, the level of income. Many who do experience food insecurity are below the poverty level. If there are any disabilities, again, race and ethnicity, as we saw in the previous chart, Black non-Hispanic households were more likely to experience food insecurity. And food accessibility, such as food deserts. So what are some of the consequences of food insecurity? So they include like malnutrition, because individuals are not consuming diverse meals. So not all nutrients are being obtained from the diet. Obesity, which can be a result of consuming ultra-processed foods, which they tend to be more affordable, and development of chronic diseases such as diabetes, which I will be discussing, and mental health is greatly affected by food insecurity, so depression can definitely arise. So what is type 2 diabetes? It is a chronic disease that occurs because blood glucose levels are too high and the pancreas cannot regulate it adequately by secreting the hormone insulin. Also, this occurs because the pancreas cannot produce enough insulin as well. It is the most common form of diabetes, and other factors that can contribute to the development of it is lifestyle factors such as being overweight or obese, physical inactivity, and smoking. Other factors to take into consideration are family history and other health conditions. So in 2018, it was reported that more than 34 million of Americans have diabetes, and of that, 90 to 95% have type 2. So that would be about 30 to 32 million that had type 2 diabetes. And also in 2018, 1.5 new million cases were diagnosed. So I think we can see how how type 2 diabetes is a great concern for public health officials. It's also the seventh leading cause of death here in the US. Aside from the huge number of cases, the healthcare costs is very high as well. So in direct and indirect costs, in 2017, they were about $327 billion. And just to show how diabetes has increased and the burden it places on our healthcare costs. So in 2012, the healthcare costs were 188 million, and that jumped up to 237 million in just 5 years. So I think we can definitely see again how this is a concern for public health officials and how it's affecting our spending money here in the US. So here I have listed some consequences of type 2 diabetes, and they usually arise from unmanaged or poorly controlled diabetes. And so because high blood glucose levels damage blood vessels and nerves, we do see an increase of cardiovascular diseases, and some of the most common ones that occur because of that damage to the blood vessels and is usually atherosclerosis, hypertension, strokes, and peripheral artery disease. And also, again, because the damage done to those nerves, we do tend to see kidney disease, nerve damage, which could lead to amputations, eye damage or vision loss, and also ultimately it decreases your lifespan. So I just went over some of the consequences of poorly controlled or unmanaged diabetes, and one way of reducing those consequences and to help the individual stay within their optimal blood glucose ranges is by having adequate nutrition and dietary intake. So individuals who do experience food insecurity, they do consume a diet that is less diverse. It is energy dense, and it usually tends to have more high caloric foods, because again, those foods do tend to be more affordable. And there may be a decrease in fresh foods such as fruits and vegetables. And the combination of having both of being food insecure and having type 2 diabetes could lead the individual to negative coping mechanisms, such as not taking their medication or less of it. Usually diabetics are prescribed insulin, so if they are not taking the adequate dosage or just not taking it at all, that's also going to affect their glycemic control. They also tend to not seek healthcare assistance, and that could include from like going for regular blood work, visiting registered dietitians to assist with their dietary intake, and just overall not visiting their doctor just for regular visits. The food insecurity also leads to the reduction of food intake and altogether skipping meals. So again, these factors will impact their blood glucose control and management. And so I think we can see that these are important goals for public health officials and individuals, including, preventing and reducing food insecurity, as well as reducing the prevalence of chronic diseases like diabetes. So I included this chart to show just how complex diabetic management is, and how it's multiple disciplinary, which, and honestly, this chart also reminds me of the very complex US food system chart that we saw at the beginning of the semester. So we can see that there's a lot of parts playing here when we're trying to, get to the main goals of care, which is preventing complications and optimizing their quality of life. So here we can see under key patient characteristics, I like that it says cultural and socioeconomic context. As we've learned, behaviors and what we eat and how we take care of ourselves is very much linked to our culture and, of course, our socioeconomic status. So definitely those are things to take into consideration when prescribing care. Another thing that I thought was very related to public health is down here, access, cost, and availability of medication. And it just reminds me how many individuals in this country do not have health insurance or sufficient resources to purchase medication. So, of course, that's where policy reform would have to come in order to assist the individuals here. And lastly, down here, just another note, I like how it says it involves an educated or informed patient. So education is key for self-efficacy and how well they understand their treatment. And of course, public health officials have a big impact of that. That's part of prevention. All right, so moving on to my recommendations on what we can do to help address these issues. It would be, firstly, I would increase SNAP benefits. We did so increase benefits by 21% this past October, which is good, but it still may not be enough. Also, this was the only increase in benefits since 1975. So that was 46 years ago. So definitely much work is still needed in this area. Next, I do suggest increasing minimum wage. Right now, Nevada's minimum wage is $8.75 per hour if they are receiving any kind of benefits, and $9.75 per hour if they are not. I think right now there is increase in food and housing expenses, so I believe these amounts may not be enough for adequate living. Next, I do think better education is needed. I would like to see nutrition classes being offered earlier in education, and not just at a college level. Like, I didn't receive any type of nutrition education until I was here at UNLV. And I believe it will help us develop skills that will last us a lifetime, like how to consume a balanced meal and how to choose adequate foods that will be beneficial to us. And also it will increase our knowledge on how to prevent the development of chronic diseases. And again, education increases self-efficacy, which is very important in healthcare. Of course, more intervention and prevention programs are needed to decrease both food insecurity and type 2 diabetes, like reducing food deserts. Of course, these recommendations do require policy additions and reforms. And I think the biggest obstacle in implementing or developing such programs, would be funding. So again, the policy to increase funding for these programs would have to change. To summarize my points, Food insecurity is episodic, but it can lead to the development of chronic diseases such as type 2 diabetes. Diabetes can be controlled with adequate nutrition, and food insecurity can be an obstacle in that care and to obtain optimal diabetes management. And I do recommend better education, better access to food, and food policy reforms in order to decrease both food insecurity and type 2 diabetes. All right, so lastly, I do have 2 questions for discussion. First question is, do you believe we should focus more on resolving food insecurity or focus on the prevention of type 2 diabetes? Second question is, what prevention programs would you recommend or would like to see in order to address these issues? And I look forward to hearing your thoughts on these questions, and thank you for your time.